I've been at Tanner for 2.5 years, 6 months as a tech and 2 years as a nurse. What brought me to Tanner was just, I grew up in Carrollton, and just being around this, I knew it was the epitome of what I wanted to work for, a company I wanted to be with, and just did so many great things for the community. So I grew up with such a positive view of Tanner, so it just seemed like the natural choice. Tanner for me was not even a question. So I didn't have the same debate in my head about who do I want to work for. I knew I wanted to work for Tanner. But I think if you're not sure, we've had people come to us and say they worked for other places and they came back to Tanner. Like, even if they left, they came back. And if they hadn't been here and they came up, then they've come 2 years later, you know? And just having people that I've been to school with say like, hey, do you like your job? Because I'm not as comfortable. And me say, yeah, I think tells you a lot about it. If other people are wondering about their job a couple years later and everyone I know who works here is happy and satisfied, I think that says like a lot about why Tanner. I think the biggest thing for me is the community part of the hospital. So like other hospitals you can go to and you're one in a million. They're not tied to their city. They're not, connected to the community the same way we are. But I feel like Tanner is a Carrollton grown, and now we've extended to lots of places, but we're a community-based hospital in the sense that like most of our employees are from this area. They have connections. Their family will be served by this hospital, and that's huge. That means that they're going to put in like a different level of care and quality to it. At Tanner, I'm advancing health with medicine beyond measure.